Okay, so first we got to choose our disease, and then after we talked about our disease that we picked with our group members and searched up facts.
And then we collaborated on it to make a visual.
Later on, we started doing the critical friends. That's when
we performed that in front of different groups.
That's when another group basically reviews you, and then they give you back the feedback.
And whoever gets the highest vote out of the groups gets to present in the theater.
And it's going to be very exciting.
Hello everybody, and welcome back to the Human Anatomy 2019 Global Health Summit. This is second period, and today we'll be discussing the viruses HIV, cholera, Zika, HPV, and smallpox. And first, we're going to start off with HIV.
Okay, so our topic is HIV and AIDS, and I'm Madison. This is Allie, Kennedy, and Paige. So there are approximately 36.9 million people in the world who live with HIV or AIDS. As of 2017, there are 5,000 worldwide diagnoses every day. Today we're going to talk to you more about how HIV and AIDS are transmitted and the actions that you can take to prevent this dangerous disease. HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. This contagion infects your white blood cells as well as your T helper cells. As the disease grows, your immune system weakens. With a slower immune system, it is easier for more diseases to enter your body, overall affecting your health. Although HIV and AIDS has been a big issue in America since the 1980s, with a spike in death around 1995, which the IHME Global Burden of Disease shows us in these two graphs, talking more about the prevalence of new cases and death from HIV and AIDS in the world, as well as just the United States alone. It shows that many people worldwide are affected by HIV and AIDS. With our presentation, we hope to bring awareness to the dangers of HIV and AIDS and what you can do to not only prevent this disease, but to also help spread awareness around you.
And treatable disease worldwide. HIV is surrounded by a huge stigma because of the immoral behavior that people associate it with. HIV is transmitted through direct contact with infected blood, semen, genital fluids, and breast milk. The two most common ways of are unprotected sex and sharing unclean, used needles. Around 15% of the 1.1 million people in the U.S. living with HIV are unaware of their status because they get tested regularly, and after infection, the only symptom once their flu until it turns into AIDS. Someone living with HIV is diagnosed with AIDS once their CD4 counts have dropped below 200. The most symptoms of HIV include on the skin, shortness of yeast infections, and bruises you cannot explain. AIDS is the last and worst stage of HIV, so once you've been diagnosed with HIV, you have to do everything you can to prevent getting AIDS.
In order to diagnose HIV, you must get a series of tests to know if you have certain antibodies to the disease or not. However, this does take some time. It can take up to 12 weeks for your body to show that you have the antibodies in your blood and saliva. Although there's no definitive cure for HIV at the moment, there are several types of medications that can be taken to help lessen the effects. An example of one is a non-nucleoside reverse transcriptase inhibitor, which turns off a certain protein that HIV needs in order to reproduce. And even though these medications help, they can be very strenuous and painful. Each person's treatment is different, but most include taking multiple medications at very specific times of the day, and they each have their own specific sets of side effects.
So as Ali said earlier, HIV is transmitted through blood products, unprotected sex, and mother-to-baby in pregnancy, labor, and nursing. It is important to educate the world about being safe in order to not contract HIV and to make sure that we take extra precautions when we are having sex or are exposed to other bodily fluids. It shouldn't be embarrassing to ask your partner if they are clean or have been checked, as this, along with abstinence, is one of the easiest ways of prevention. Another way to prevent HIV is to take pre-exposure prophylaxis, or PrEP. After the disease's asymptotic stage, it progresses into another disease known as AIDS, so the best way to prevent AIDS is to follow through with the HIV prevention methods. Another thing that we as a whole need to do is not give in to stigmas or myths about HIV, as many people believe you can get HIV from simply being next to someone who has already had it. But this is not true, as HIV isn't spread through tears, sweat, or saliva. Myths like these put those diagnosed into a state of isolation where human contact and support is what they need most. These myths hold the world back from fully understanding HIV. Princess Diana once said, "HIV does not make people dangerous to know, so you can shake their hands and give them a hug. Heaven knows they need it." Thank you.
Great job, HIV. And now for cholera.
Hello, I'm Alicia, this is Isabella, Namari, and Hannah, and this is Cholera. Today, we're here to tell you a little story about our good friend, Simba. Now, you may have heard of him. He's a character in the new Lion King movie. Well, he came into our clinic earlier this year, and he displayed a variety of symptoms such as severe diarrhea and dehydration. Of course, there are many different diseases and illnesses that share these symptoms, but one in particular really stands out: cholera.
All right, so what is cholera? Cholera is an intestinal infection caused by the bacteria known as Vibrio cholerae. Typical symptoms include fever, diarrhea, vomiting, and lots of dehydration. In the majority of cases, contaminated water, but can also transmit to contaminated food. Let's take a step back. Who here has drank water? Food. That should be everyone. And if you didn't raise your hand, I'm starting to question if you're truly human. Now, let's face it. The fact is that we take clean food and water granted on a daily basis. Okay, and if you reflect, it's like an everyday thing, right? But when you look back, there's people who don't have clean water. Think about it. 844 million people, all water. Tell me about that. It's crazy, right? 804 million people that probably don't even have water. Now, let's take a step back. If you put all these statistics and all this research and studies and everything we've gathered in the past couple years, you realize that there's roughly 3 million cases of cholera every year. And there's an average of 90,000 deaths caused by cholera. Crazy, right? You never really think about it. How much damage can contaminated water really do? And now if you look even further, cholera has been recognized by the one and only father of medicine, Hippocrates, and only then it was considered a diarrheal disease. Cholera has been known to have caused 6 subsequent pandemics all around the globe, killing millions and millions of people. Ladies and gentlemen, this is not a new issue, and it needs to be addressed.
Now, considering Simba's environment and living conditions, we thought that the most probable cause of his discomfort and illness was cholera. While it is rare, it's not extinct. At the same time that he had gotten sick, his home in Kenya had been experiencing a recent cholera outbreak. And although it wasn't as deadly as the previous ones, such as the one in 2018, which was also in Kenya, the outbreak in January 2019 had experienced a significant amount of reported cases in the county of Narok, Kajiado, Nairobi, Garissa, and Machakos. There had been about 1,735 cases in total, 91 which had been confirmed, along with 11 deaths. What we had noticed as we hydrated Simba was that he had been sweating profusely, and we also hooked him up to an IV as part of their treatment.
Vibrio 01 cholera is a common causative for acute watery diarrhea for both adults and children. After colonizing the proximal small intestine, the bacterium starts releasing cholera toxin. So the immune response for cholera is initiated in Peyer's patches or the gastrointestinal mucosa, followed by migration of antigen-specific B cells to regional lymph nodes. While you might be asking yourself, if cholera is treatable, why do we keep seeing outbreaks? Why do we keep seeing people die? Why are people dying when the medicine is so inexpensive and constantly available? It's just clean water. Well, cholera is treatable, but poverty is not. Countries like Kenya suffer greatly economically and politically that they can't afford water filtration systems. In fact, Kenya is ranked the 130th country economically worldwide. So you can see how conditions like economics and politics can really play a big role, and it's not necessarily the medicine that's the problem in this case.
Since the OCV, or the oral cholera vaccine, has been shown to be unreliable in its protection of adults and ineffective in children, scientists have been focusing their efforts on new research. There has been new research in labs recently that may point to a new solution. In this research, there has been an induction of memory B cells following infection that may play a larger role in a longer lasting protection. In addition, there has been shown that there is an innate component in the immune system that may play a large role in the host response to cholera.
In conclusion, cholera is a vastly underestimated disease by the majority of the people because of how simple the medication is. That's why we encourage you and we urge you to raise awareness by telling a friend, fundraising for the cause, or just really informing people of what they don't know about it. Thank you.
Hi, my name is Tammy Lee.
Hi, I'm Michelle.
Hi, my name is Tammy Lee.
Hi, I'm Michelle.
I'm Annie.
My name is Irene.
And we have the Zika virus.
What's up, Michelle? What did you do over summer?
I went to Brazil and I went swimming in a bunch of lakes and rivers, but I did get a lot of mosquito bites.
Mosquito bites?
Yeah, what's wrong with that?
You could have the Zika virus. The Zika virus is a virus that people can contract through mosquitoes. It was first identified in humans in 1952 in Africa. The virus mainly affects the brain cells and then the immune system. How the virus spreads is by infecting the cells of a host to multiply, and then later on the virus RNA accumulates to the cell. Now there are two main examples of the Zika virus that have happened in the world. The first example is that when a pregnant woman gets the Zika virus, then that can result in the baby coming out with severe birth defects such as microcephaly, or the woman could even have a miscarriage. The second example is that in 2016, people from all over the world went to Brazil. The reason why? The 2016 Olympics. Now, the people who went there, at that time, the Zika outbreak had happened, so when they went back to their countries, along with themselves, they brought the disease. Pregnant woman issue is mainly happening in Brazil, Asia, and Africa. And lastly, the disease of Zika virus is called nothing else, but we should still be aware of how it could break worldwide.
So people can have no symptoms, but people do experience having pain in the back of their eyes, muscles, lower back, and joints, usually in the smaller joints of the hands and feet, and usually it's with swelling. People also have fevers, headaches, they could vomit, have a loss of appetite, and have a really high temperature. Although Zika isn't fatal, pregnant women, if a pregnant woman has Zika, it can get transferred into their fetus, which can cause infection during pregnancy and serious birth defects such as microcephaly. Microcephaly is when the baby's brain is smaller compared to the average size, and that's because it's not fully developed properly.
Okay, so Zika is such a big problem because the children that are affected with microcephaly could grow up to be the next president, the next pope, or even the person who cures cancer, but we wouldn't know because many of the children die when they're very young because their brains are so underdeveloped. So in one case, a woman in Brazil had a child with microcephaly, but on top of that, she had lung cancer, she was deaf in one ear, and her husband had also left her so she could raise her 2 kids by herself. And additionally, the government wasn't giving her any pension, they weren't supporting her, so she had to stay at the hospital and take care of her children, while at the same time trying to make money to raise her children so they can be happy and healthy. And this was such a big problem because in that time period, she thought it was her fault. She blamed herself for everything, that was happening to her children because of her, but it wasn't because of her, it was because of the Zika virus, because the Zika virus was the one who infected her and which caused her child to be born with microcephaly. And as of now, there is no known cure for the Zika virus, but many doctors are currently conducting multiple clinical trials to try and find a cure. And the best way to prevent Zika is to wear thick, long clothing, bug spray, and mosquito repellent, and to avoid traveling to tropical places such as Brazil or Africa to avoid mosquitoes.
So the Zika virus can be transmitted in 3 ways. The first way would be through mosquitoes. The Aedes species, which carries Zika virus, has also carried yellow fever and dengue fever in the past and are responsible for transmitting the virus. The virus is transmitted when an infected female mosquito pierces the human skin. The human becomes a host for the virus and allowing other viruses to become infected and allowing more humans to be infected as well. This cycle is the fastest way Zika can spread. The second way is when a pregnant woman gives birth. Her baby will be born with Zika and also microcephaly. This means that pregnant women are the most at risk and should be very cautious and careful. The third way is the virus can be spread through sexual intercourse. Since the virus is relatively new for scientists and researchers, they're still studying how long it takes for the virus to be spread through partners. What they have discovered is that the virus can be spread from a person before they show symptoms, during, after, and even from a person that doesn't show any symptoms at all. This is why Zika is so dangerous. It can remain undetected for a really long time, and you can have Zika without ever knowing it. We hope that all of you remain very cautious of these symptoms and these ways, and we hope that none of you ever contract Zika ever. Thank you.
Amazing job, Zika virus. Now we're gonna go transition to HPV.
Oh, we need to switch. Hi, I'm Kyler. This is Ali. This is Daniel. And that's Anastasia.
All right, and we have, okay, wait, all right, give me an H. Give me a P. Give me a V. What's that spell? Yeah, so we got HPV. Yeah.
We have HPV, also known as human papilloma virus. Papilloma means warts, so really it's called human warts virus, and it is the most common sexually transmitted disease in the world. Every year, around 14 million people get it, and because there are over 200 different types, it can lead to very dangerous cancers such as penile, vaginal, and cervical cancer. Cervical cancer is very dangerous for women because it can lead to deaths, many deaths, and it has led to over 250,000 deaths around the world. And this usually occurs in third world countries because they don't have the. And a little history about HPV is that the vaccine was legalized in 2006.
All right, so like Anastasia said, HPV is a sexually transmitted disease, but it be specifically through intercourse. You can get it through, you can just get it through skin-to-skin contact. A lot of it doesn't have to be what we think of as intercourse. It could just be, it could be through birth as well. So like the most common types of areas that you get HPV would be around your genital areas. You can also get them around like your elbows, your knees, and stuff like that. So what happens when a woman were to have HPV and give birth to a child, the child would grow up with HPV. It would have to grow up with many lung problems and many genital problems. It would have to spend a lot of their time in the hospitals and like getting a bunch of treatment and stuff like that.
So as Daniel was saying, HPV is pretty gross. So if you don't want it, you can take vaccines from ages 11 to 12, or you could just not have sex forever. But if you do want to have sex, then you can use protection, but it's not effective, so you can still get it. So I would not have sex if you don't want HPV. So some of the symptoms of HPV, you can get warts, and those are gross. They look really bad. They're like pimples, but juiced up. So if you don't want warts, you can get rid of them by laser removal or freezing them or buying some nice cream from CVS. And luckily, if you don't get warts, you could get cancer, which is even worse. And if you don't want cancer, you should see a doctor because abnormal growths could start growing, and that's how you get rid of cancer.
Okay. So as Anastasia said, that there are many types of common types are, I mean, which are most likely, and then those cancers will lead to genital cancers, and then also they're most likely to lead to tongue cancer, throat cancer, or tonsil cancer, and those types of cancers more problems and more doctor visits. So HPV, okay, there are more causes of HPV in less economical countries such as Africa, and Anastasia said that there are 14 million cases in America, but worldwide there are like over 20 million, which means that there are more across the world than in America because we have more vaccines and protections towards HPV. HPV is a very dangerous virus, and hopefully nobody gets it. Thank you for listening to our presentation.
Oh, yeah.
Well done, HPV. And now we're going to conclude this period with smallpox.
Hi everyone, I'm Anna.
I'm Daniela.
I'm Millie.
And I'm Tiff.
And we're presenting the smallpox. Okay, so imagine a kid coming home from school, but he has a fever, right? And so his parents, thinking he got the annual bug, take him to his family physician. And after getting treated, his symptoms start to recede. And he feels fine, everything's good, he's playing around. But then suddenly, a week later, his symptoms come back, but like 10 times stronger. And he feels weak and he feels very fatigued. And then he starts noticing small pimples, like they're like rashes and they're red and they look like pimples. And then the pimples start filling with pus, and the pus breaks open and it looks very weird on the skin. And then they start to scab over. And around this time, he is very contagious, so like you can't go anywhere around him. And his immune system is so weak that like anything, like little small bacteria could kill him.
So this was smallpox, and smallpox is an acute contagious viral disease with fever and pustules usually leaving permanent scars. It was effectively eradicated through vaccination by 1980. When smallpox enters the cell, it enters through the cytoplasm and replicates. It then enters the respiratory system and multiplies there. During the process, 2 bursts of viremia take place. The smallpox pathogen incubates in the body for 10 to 12 days. The early symptoms of smallpox are severe headaches, fevers, and prostration.
Smallpox is thought to originate from India or Egypt way back in BC. The basis for vaccinations began in 1796 when an English doctor by the name of Edward Jenner discovered how to inoculate a person from smallpox. He noticed that the milkmaids were not getting smallpox because they already had cowpox. He used this idea to test out his hypothesis on vaccinations.
Before smallpox was popularized, the primary source of contact was face-to-face or skin-to-skin. This can further spread the virus by coughing, sneezing, because droplets of bacteria from your body can spread when these 2 factors are in effect. Eventually, scab-like features can form on the body and they can cover everything on your body. The interior of the scab is filled with the variola virus, in which it can enhance the forms of contact by infecting everyday necessities such as bedding or clothing.
Now, the symptoms usually appear about 10 to 14 days after you get infected. There's this period between 7 to 10 days called the incubation period, where you'll seem very healthy, but that's not the case. A few weeks later, you'll start getting the flu-like symptoms I mentioned before: severe fatigue, high fever, and pain all over your body. And then later on, you'll start developing those fatal rashes, and those rashes will turn to pus, or fill with pus, and they'll break open and cause these ugly scars, and your immune system will be very weak. And of course, since there's no cure for smallpox, you would pass away.
Diagnosis is difficult because it can be confused for chickenpox. An examination of the symptoms would help to narrow down the selection of viruses. A blood test is much more accurate in determining what kind of virus it is.
There is no current cure or treatment for smallpox if you contract it, but there is post-exposure emergency medication that you can take to lower the severity of the smallpox. The best treatment option would be supportive care. It is also important to isolate and adhere to viral infection controls to prevent the further spread of the virus.
The best method of prevention can be having smallpox vaccinations. Smallpox was in fact eradicated in 1980 because of how effective these vaccines were. They are created to help inject a dead virus into the body, and therefore it will help the white blood cells to attack the virus or infection. To prevent the body from being susceptible to the virus also is included into the vaccination.
Okay, so the last person to die was Janet Parker in 1978. She is a medical photographer who works at a medical university in England, one floor above an area where they were testing cures and vaccines for smallpox. She later develops those fatal rashes, and she dies a month later. The reason why was because they didn't know that she had the rashes. They were 9 days too late. So 9 days could make a difference between you living or dying with smallpox. And they don't know the reason how she got smallpox. It was either because the ventilation was bad, or she might have gone into the floor, which she wasn't allowed to, without any protection. And so therefore, all in all, please don't work near smallpox. You don't want to die. Thank you.
Fantastic job, Smallpox, and thank you everyone for joining us this period and learning a bit more about the smallpox, HIV, cholera, Zika, and HPV virus. Please join us next period as we learn about E. coli, smallpox, seasonal flu, and the HIV virus. And don't forget to have an amazing day. Thank you.